"I thought you weren't following instructions." Those were the words that I never expected to hear from my doctor, and they changed the entire trajectory of my healthcare. Those simple words led to a proper diagnosis of rheumatoid arthritis and Sjögren syndrome after 7 years of struggling, being dismissed, and ignored. But that wasn't where my journey started. It began in 2012 when I first learned I had autoimmune antibodies, but the truth about my health took years to uncover. Hi, my name is Tanisha Campbell, and I equip healthcare providers with practical strategies to challenge bias, reduce healthcare disparities, and deliver compassionate care for Black women. In 2012, I was a corporal in the United States Marine Corps preparing for an embassy assignment in Lagos, Nigeria. But when I failed a physical examination, I learned I had SSA and SSB antibodies, which pointed to an autoimmune condition. The issue, well, no one could tell what condition it was, so I spent months waiting for answers while continuing to serve. Fast forward to 2019, I was finally diagnosed with rheumatoid arthritis and Sjögren after countless dismissals and doctors attributing my symptoms to anything but a real diagnosis. That's why today I want to talk about how unconscious bias in healthcare directly impacts Black women's health. If you're a healthcare provider or someone who wants to understand these challenges, this video is for you. We'll dive into how bias can delay diagnosis and affect healthcare outcomes, especially for Black women. Let's start with some key facts. According to a Stanford medicine study, over 24 million Americans live with autoimmune diseases, and a staggering 4 out of 5 of those individuals are women. What's even worse is certain autoimmune diseases disproportionately affect women, and Black women are especially vulnerable. But there's something deeper at play here: unconscious bias in healthcare. For me, the reason it took so long to get a diagnosis wasn't just because of the condition itself. It was because healthcare providers often don't recognize their unconscious biases and assumptions about their patients. My doctor was finally able to look beyond those assumptions, and that's when he ordered the test that saved my health. Had he not taken that step, I might still be waiting for answers today. Now let's break down why this is a major issue for Black women's health. 1. Unconscious bias delays proper care. Healthcare providers often don't realize that their assumptions can lead to misdiagnosis or delays in treatment. If you don't recognize your bias, you might not see your patient's true needs. 2. Bias affects outcomes, especially for Black women. Studies have shown that Black women are more likely to be dismissed or have their symptoms downplayed. This isn't an isolated issue, it's part of a broader pattern of racial disparities in healthcare. And 3. Training and awareness can change everything. By simply addressing unconscious bias and providing healthcare workers with the tools to challenge it, we can improve patient outcomes. That training can make all the difference for someone like me and for countless other Black women who struggle to receive the care they deserve. Given changes in healthcare policies and challenges facing diversity, equity, and inclusion efforts, it's crucial we think, how can we approach healthcare? We can't afford to ignore these issues, especially when they impact Black women's health and lives. So if you found this video helpful, don't forget to subscribe to the Enhance Black Women's Health YouTube channel for more insights and updates. And together, we can create a healthcare system that works for everyone.